Hi, I'm Sheila Decker. Today we're going to be treating a patient who has a few conditions secondary to her eating disorder, which is what we're going to be really focusing on. This patient denies her eating disorder and has a lot of other psychological factors such as depression and anxiety. So we're going to be really careful about the way we approach it to her. So we're going to be starting with some relaxation and breathing exercises just to get her calmed down and relaxed, focused on what we're going to be doing, and then we're going to be using some goal setting and mental imagery to kind of facilitate how she thinks about her diet and the way she eats and her weight. So, all right.
Good morning, Judith. How are you feeling today?
I'm feeling okay.
Okay. How has your rest been going?
Okay.
Okay. All right. Well, this morning we're just gonna start with a few simple techniques to get your weight up because we're trying to maintain 125 pounds so that you can return to rowing. Um, so what we're gonna start with is just some breathing exercises, and then we're gonna move into some goal setting and mental imagery. So whenever you're ready, I'm just going to have you take a big deep breath in through your nose and let it out through your mouth. All right, so let's get a few of those. Let's say 5. All right, so then when you're ready, you can let your breath return to its natural state. Gently close your eyes. So right now, what we're trying to get to happen is for you to put on a little bit of weight. So in order for that to happen, that means you need to start eating a bit more nutritionally balanced food. So I want you to visualize in your head a plate, and it's full of all different foods. So about half your plate is going to be full of vegetables, all different colors, some greens, oranges, like sweet potatoes, and carrots. Um, then on part of your plate, you're going to have a protein source, so that can be whatever you want. Chicken, steak, other protein. Oh yeah, you're vegetarian. Tofu, and then a little bit of fat, so something like a treat on the side, like a bit of avocado, or even something like um, coconut oil, olive oil, any sort of butters that you like. So now I want you to think about eating that food, and you're enjoying it, you're thinking about how good it tastes, thinking about all the flavors. Hearing the sound of your fork clink, clink, clink on the plate. It's so delicious. You just want to finish all of it. All right, so now we've finished our food. So it's traveling down our esophagus, into the stomach. It's getting all churned around in there, with all our other food. And then it's starting to come through our small intestine. I want you to visualize this food making its way through your body, all the nutrients getting absorbed and brought into your blood. I want you to visualize all the small bonds getting broken between your food, so it's getting broken down into its individual components, all the carbohydrates, the protein, the fats, getting broken into simple sugars, amino acids. I want you to visualize all of this material being used to replenish the rest of your body. So it's bringing all this new energy throughout the whole thing, all the way to your toes, your fingertips, your brain, all your muscles. Feel all the glycogen and glucose getting replenished in your muscles. Feel how all this nutrition is supporting you, making you stronger. Next, I want you to visualize yourself now. I want you to think about rowing or running your marathon or whatever it is that you really want to achieve, and think about how all this nutrition, all of the replenishment for your body, for your muscles, how that's going to help you achieve your goal. So if you're rowing, it's helping you push off the block every time, come back to your starting position, helping you really drive the oars through the water. If it's running, your muscles are pumping, you're driving your knees, feet hitting the ground. And feel all the energy that you have because of this nutritional meal that you ate. All right, now take we'll go for another 5 big deep breaths into your nose, not through your mouth. And when you're ready, you can gently open your eyes. Taking your surroundings, remember where we are. When you're ready, you can sit on up. All right, how are you feeling, Edith?
Pretty good.
Yeah. All right.